A vestibular schwannoma is a benign tumor that comes from the balance nerve, the vestibular nerve. It actually comes from these cells that line that nerve. There is a lot of confusion often between, is it an acoustic neuroma or a vestibular schwannoma? What's the difference? The answer is there's no difference. The acoustic neuroma is the older name. That name developed because these tumors often cause hearing loss, but actually the tumor is coming from the vestibular nerve. And so the scientifically correct term is vestibular schwannoma. The most common way that vestibular schwannomas are identified are usually by the symptom of hearing loss, and particularly hearing loss worse in one ear compared to the other ear. Other common symptoms would include dizziness, or less dizziness, but often more imbalance. Usually, the balance symptoms are relatively mild and subtle, and most people don't notice them. It's usually more, I feel like I need to catch myself a little bit more. Other symptoms that can happen, theoretically, you can have facial weakness or difficulty moving the muscles of the face. That's really uncommon, but it can happen. If it's big enough, it can start to cause really severe balance problems as it compresses the brain stem, can cause headaches, can cause what we call hydrocephalus, which is basically excess fluid in the brain. So the treatments for vestibular schwannoma, there are three main ones. There's observation, there's radiosurgery, and then there's microsurgery. Because these are benign tumors that are slow growing, very often we can just observe these. Many of these tumors actually won't grow for many years. Now, there are some that are faster growing, and so that's why we will get MRIs. Usually, I get an MRI 6 months after the first MRI, and then MRIs annually after if it's not growing. Our aim with treatment is to prevent it from getting bigger and causing more problems as it compresses the brain.